My name is Oliver Rivero-Arias and I'm an Associate Professor at the University of Oxford and one of the lead investigators of the Valentia study with Professor Stavros Petrou, also from the University of Oxford. The Valentia study is a National Institute for Health Research funded study, and it involves a multidisciplinary collaboration with different institutions across the UK, which includes clinicians, includes the academia and parent representatives. The aim of the Valentia study is to understand whether a particular type of information that is used to decide whether to implement or not a screening program in the NHS and any other healthcare systems elsewhere, whether they account for benefits and harms in a sensible and clear way. In order to do this, we have developed a program of work that involves 4 different work packages. In Work Package 1, and that's the work package that is led by the health economists, we are reviewing the literature and trying to understand a bit better how these particular type of documents that are called health economic assessments, how they incorporate these benefits and harms. We're going to be looking to we're going to be looking to the scientific literature, but we're also going to be looking at something called grey literature, which doesn't necessarily follows under the scientific umbrella, but there are sensible and very serious documentation that are used by different decision-making bodies. And we're going to be contacting different organizations and asking for that information in order for us to review how benefits and harms have been accounted for. In Work Package 2, and that's the work package led by our qualitative team, we will be identifying and summarizing the experiences of people affected by the results of a screening test. And that, of course, will include the mother, members of the family, and other stakeholders, for example, healthcare professionals. We will be reanalyzing interviews that we already got access to, but also we will be conducting our own set of interviews to understand about these experiences and how they link with benefits and harms of screening programs. Work Package 3, it's a way of synthesizing what the health economics team finds out in Work Package 1 and what the qualitative research team finds out in Work Package 2. So we put them together in we call it, we are going to synthesize the information from the 2 teams in one package that we have called it like a narrative synthesis of both the published and grey literature, but also the information from the qualitative component. In Work Package 4, we are going to show different stakeholders, and that will involve parents, it will involve healthcare professionals, it will involve parents and patient organizations, and we're going to show them what we have found. And we will try to come up with a set of recommendations that then we can publish and we can present to important institutions that use these health economic assessments in the future. Finally, and not least important, but probably the most important component of the Valentia study is our parent and public involvement, what is called PPI. Since the original preparation of the proposal for the study, we were clear that we wanted a strong PPI component in the project, and the reason it was that the breadth of experiences that people have depending on the result of screening test vary enormously, and we wanted to be able to have that voice within our research team. That also introduces some complications about from, for example, a normal PPI, because we aim to have around 30 members, and all these members got different views. And given the current situation where we are with COVID, and also because of the nature of some of the conversations that we wanted to have, we knew that we couldn't have all the people together. So if you are a member of our PPI team, on behalf of the whole Valentia team, thank you very much for being part of this, and we are looking forward to working with you. If you're interested in being a PPI member for the Valentia study, we do have contacts at the end of this video. We do have contacts on our website where you can contact the lead investigators, our PPI coordinator, and just keep in touch and send us an email that you're interested in, and we can go from there. We have prepared a series. We have prepared another 3 videos in addition to this introduction that we recommend if you're a PPI member or if you are generally interested in the Valentia study that you look at. There is a video about an introduction to health economic assessments. As this project is as a health economics project, we thought it would be nice for people to understand what we are going to be talking about. There is also another video about qualitative research and what it is and what is that we are going to be doing in the Valentia study. And finally, there is also a video about PPI, and that explains what the role of the PPI is, how we are going to be using the PPI information, and how we are going to be interacting with our PPI members. So if you got an interest in any of this, if you're a PPI member, again, thank you very much for being part of the research, and looking forward to collaborate with you. And if you got an interest, or anyone who's got an interest, just feel free to send us an email or an email either to myself, Oliver, Stavros, or our PPI coordinator. Thank you very much.